Why did a woman die every 2 minutes from childbirth in 2023? And why did Nigeria account for the highest number of these deaths? Bringing a child into the world should be one of life's most joyful moments. Yet, in Nigeria, it often ends in tragedy. The country has one of the highest maternal mortality ratios in the world. For every 100,000 live births, 993 women die while trying to give life. So what's driving this crisis, and how can it be addressed? Let's break this down. Meet Zuri. For 9 months, she's been preparing to welcome her baby. She bought tiny clothes, picked out a name, and even chose her favorite lullabies to sing. Now she's in labor. It's been 14 hours. She's in a rural clinic without electricity. The only skilled birth attendant isn't on duty, and the nurse present lacks the training to manage severe complications. Then Zuri begins to bleed. There's no one to stop it. No trained staff, no adequate equipment, and no blood bank at the clinic. Tragically, Zuri loses her life before ever having a chance to meet her baby. Maternal mortality refers to a woman dying while pregnant or within 42 days of giving birth from causes linked to pregnancy and childbirth. Child mortality refers to deaths of babies and children under 5, often from preventable conditions. In Nigeria, both are heartbreakingly common. In 2023 alone, around 75,000 Nigerian women died from pregnancy or childbirth-related complications, according to the World Health Organization. And it's not just the mothers. Thousands of babies and young children die each year from being born prematurely, malnutrition, poor health care, or something as simple as a lack of clean water. So what's causing all these deaths? Let's start with the mothers. The leading cause of maternal mortality is postpartum hemorrhage. This is severe bleeding after childbirth, like the case of Zuri. This usually happens when the uterus fails to contract properly. Postpartum hemorrhage alone accounts for 22% of maternal deaths in Nigeria. Other major causes include infections after delivery, unsafe abortions, a lack of skilled healthcare professionals, and poorly equipped healthcare centers. Cultural barriers also play a role. Many women still rely on traditional practices, but experts emphasize that seeking medical help should be seen as essential and not as a last resort. Sadly, in many Nigerian communities, especially in rural areas, healthcare systems are underfunded, under-equipped, and understaffed. The World Bank ranks Nigeria 42nd out of 100 on its Universal Health Coverage Index, clearly indicating how much work remains. According to research, there are 3 delays that kill. Delay in seeking care due to lack of knowledge, cultural beliefs, or fear. Delay in reaching care because of poor roads, long distances, or no transportation. Delay in receiving care due to overwhelmed clinics, staff shortages, or lack of supplies. All 3 are common in Nigeria. But how dangerous is it? Very. Nigeria accounts for 28.7% of all maternal deaths. That means nearly 1 in every 4 women who die during pregnancy or childbirth in the world lives in Nigeria. Let's put it into perspective. Women in Nigeria face a 1 in 22 lifetime risk of dying from pregnancy-related causes. In contrast, women in the most developed countries have a 1 in 4,900 chance. The gap is staggering. Now, what about the children? Sadly, they're dying too. Child mortality in Nigeria is higher than the global average. As of 2024, About 54 out of every 1,000 babies born in Nigeria do not survive their first year. Nigeria alone accounts for roughly 16% of all deaths of children under 5 worldwide. Many are born prematurely, others miss out on essential vaccines, some suffer from severe malnutrition. Far too many die simply because they lack access to clean water, warmth, or basic medical care. But there's hope. Solutions exist, and some are already underway. Sustainable Development Goal 3.1 sets an ambitious target to reduce global maternal mortality to fewer than 70 deaths per 100,000 live births by 2030. The clock is ticking. So what is Nigeria doing? In 2018, the government launched the National Strategic Health Development Plan 2. Priority Area 4 addresses reproductive, maternal, newborn, child, and adolescent health and nutrition. It may be a mouthful, but at its core, the plan is about delivering quality care for everyone, especially the most vulnerable. So pregnant women, newborns, children, and teenagers. Its goals include improving access to sexual and reproductive health care, reducing illness and death amongst mothers and children, building stronger and more responsive healthcare systems, starting with primary care. More recently, in July 2024, Nigeria introduced the Health Sector Renewal Investment Initiative, a collaborative effort bringing together government, global partners, and donors under one roof, working as a team. It is backed by $500 million in World Bank funding, along with $70 million in grants from partners such as the Global Financing Facility, the UK's Foreign, Commonwealth and Development Office, and the Children's Investment Fund Foundation. That's $570 million directed at maternal and child health, supporting rural clinics, training healthcare workers, providing free emergency care, and supplying essential medicines and equipment. Nigeria can also learn from countries that have made real progress. Take India. In 2005, it introduced the Janani Suraksha Yojana, a cash initiative scheme that encouraged women to give birth in health facilities, helping to reduce maternal deaths, especially in rural areas. The impact was striking. Poor and rural women were suddenly choosing clinics over home births. In just 2 years, institutional deliveries rose from 47% to 72.9%. Maternal mortality dropped by 16.5%, and neonatal mortality rate fell from 37 to 33% within 4 years. This proves something vital. Lives are saved when financial and access barriers are removed. And this isn't just about numbers. It's about real people, hopeful, expectant mothers, tiny newborns whose first breaths are sometimes their last, and families devastated by losses that could have been prevented. Nigeria must prioritize strengthening primary healthcare facilities, especially in rural areas. Healthcare must be affordable. No one should die simply because they cannot afford to pay. And policies must be designed and implemented with people, not politics, at their core. Health is the foundation of any nation's prosperity. It must be protected, and it must come first.